Hi everyone, welcome back to my YouTube channel. In today's video, I will be talking about CMS proposed rule for Inpatient Rehabilitation Facility Prospective Payment System for the fiscal year 2023. Let's get started. On March 31st of 2022, CMS, or the Centers for Medicare and Medicaid Services, issued a proposed rule to update Medicare payment policies and rates under the Inpatient Rehabilitation Facility, or IRF Prospective Payment System, or PPS, and the IRF Quality Reporting Program, or QRP, for fiscal year 2023. CMS is publishing this proposed rule in accordance with the legal requirements to update Medicare payment policies for IRFs on an annual basis. Proposed updates to the fiscal year 2023 IRF PPS payment policies. For fiscal year 2023, CMS is proposing to update the IRF PPS payment rates by 2.8% based on the IRF market basket update of 3.2% less a 0.4 percentage point productivity adjustment. CMS is proposing that if more recent data become available, for example, a more recent estimate of the market basket update or productivity adjustment, CMS would use these data, if appropriate, to determine the fiscal year 2023 market basket update and the productivity adjustment in the final rule. In addition, the proposed rule contains an adjustment to the outlier threshold to maintain outlier payments at 3% of total payments. This adjustment will result in a 0.8 percentage point decrease in outlier payments. CMS estimates that overall IRF payments for fiscal year 2023 would increase by 2% or $170 million relative to payments in fiscal year 2022. Proposed permanent cap on wage index decreases. In order to mitigate instability in IRF PPS payments due to significant wage index decreases that may affect providers in any given year, CMS is proposing a permanent 5% cap on annual wage index decreases to smooth year-to-year changes in providers' wage index payments. Soliciting comments on the Office of Inspector General, or OIG, recommendation to include home health in the IRF transfer policy. A recent Office of Inspector General, or OIG, report that evaluated early discharges from IRFs to home health recommended that CMS expand the IRF transfer payment policy to apply to early discharges to home health. To assist CMS in balancing the needs of the patient while at the same time ensuring the integrity of the Medicare program, CMS is seeking feedback from stakeholders about potentially including home health in the IRF transfer payment policy as recommended by OIG. CMS plans to analyze home health claims to determine the appropriateness of including home health in the IRF transfer policy and is seeking comment to inform this future analysis and any potential future rulemaking. Soliciting comments on the methodology for updating the facility level adjustment factors, specifically the rural, low income, and teaching status adjustments. CMS is seeking public comments regarding the methodology used to determine the facility level adjustment factors and suggestions for what may be driving the variability in the IRF teaching status adjustment factor. IRF teaching status adjustment policy. CMS is proposing to codify their long-standing IRF teaching status adjustment policy in regulation and clarify certain teaching status adjustment policies. Proposed updates to the IRF Quality Reporting Program, or QRP. The IRF QRP is a pay-for-reporting program. IRFs that do not meet reporting requirements are subject to a 2 percentage point reduction in their annual increase factor, or AIF. CMS is proposing one policy change and is putting forth 3 requests for information, or RFIS, related to the IRF QRP. Quality data reporting on all IRF patients regardless of payer. CMS is proposing to expand the IRF quality data reporting requirements, which currently apply to all admitted IRF patients with Medicare Part A, fee-for-service or FFS, and Medicare Part C such that IRFs would begin collecting data on all IRF patients regardless of payer. This policy proposal would help to ensure all IRF patients are receiving the same quality of care and that provider metrics reflect performance across the spectrum of IRF patients. CMS is proposing that this expanded quality reporting requirement would take effect starting with the fiscal year 2025 IRF QRP, meaning that providers would need to start collecting the IRF Patient Assessment Instrument or PI assessment on all patients receiving care in an IRF, regardless of payer, beginning on October 1st, 2023. Inclusion of the National Healthcare Safety Network or NHSN healthcare associated Clostridioides difficile or C. difficile infection outcome measure in the IRF Quality Reporting Program Request for Information or RFI. CMS is seeking stakeholder feedback on the future inclusion of the National Healthcare Safety Network or NHSN healthcare associated Clostridioides difficile infection or HACDI outcome measure as a digital quality measure in the IRF Quality Reporting Program. This measure tracks the development of new C. difficile infection among patients already admitted to IRFs using algorithmic determinations from data sources widely available in electronic health records. This measure improves on the existing NHSN facility-wide inpatient hospital onset Clostridium difficile infection or CDI outcome measure, which is also National Quality Forum measure number 1717, by requiring both microbiologic evidence of C. difficile in stool and evidence of antimicrobial treatment. Through this RFI, CMS would like to assess the feasibility of this digital measure in IRFs. If this type of measure is proposed and finalized in a future rule, this would be the first digital measure in the IRF Quality Reporting Program. Overarching principles for measuring equity and healthcare quality disparities across CMS quality programs request for information or RFI. CMS is committed to achieving equity in healthcare outcomes for their beneficiaries. In this RFI, CMS provides an update on the equity work that is occurring across CMS. Included are their plans to expand their quality reporting programs to allow them to provide more actionable, comprehensive information on healthcare disparities, measuring healthcare disparities through quality measurement and reporting these results to providers, and providing an update on their methods and research around measure development and disparity reporting. CMS believes that a focused health equity measure would provide specific equity data that will help providers develop innovative and targeted interventions for impacted groups and would additionally provide transparency for beneficiaries. CMS also believes that by leveraging measures to give providers access to disparity information, they would be able to use this data to make informed decisions about their quality improvement initiatives. In this RFI, CMS is requesting feedback from stakeholders on the development and inclusion of health equity quality measures for the IRF Quality Reporting Program. This is it for today. Thank you for joining me. If you found this information useful, please consider subscribing to my channel and leave me a few comments. Hope to see you next time. Bye now.